Hello, good evening. So nice to see all of you this evening, and so nice to be in Montserrat. This is my first time. I don't sound like it, but I was actually born in Dominica and spent my summers there every summer until I was 14 and have been back intermittently and never got over to Montserrat. So it's a pleasure visiting my neighbors and being here for the first time. My portion of the presentation is just to talk a little bit about diabetes, just to give you a little refresher just about how serious this problem is. Initially, many decades ago, infections were more commonly the cause of people getting ill, people dying in the Caribbean. Diseases that you could get by infection. But now there's been a transition that has been going on, and over the past 3 decades, that transition is now no longer infections, but chronic diseases. Chronic diseases such as diabetes, heart disease, strokes, high cholesterol. Those are becoming more prominent and more the cause of sickness and death in this region. Next slide, please. In terms of generally what diabetes is, normally when you don't have diabetes, our body handles sugar by something called insulin. It helps to control the levels and bring it into a normal range after you eat something that contains sugar or that causes your sugar to go up. However, people who have diabetes or don't handle sugar very well, those sugar levels get high by eating something, and it stays high. The body can't handle it, can't process it because of different things, and it stays high in the body, and even though you may not feel it, it causes significant damage to various parts of the body, in terms of the heart, in terms of the kidneys, in terms of your eyesight, in terms of your limbs. So even though you may not feel it, but you may not feel it, oftentimes high levels of sugar continuously in the body is a very damaging thing. Doctors diagnose it by various blood tests that check for various levels of your blood sugar. Next slide. The World Health Organization has put out information with staggering statistics. Hundreds and millions of people are affected worldwide by diabetes. Almost 300 million. And by 2030, it's projected that there's going to be almost a double increase in the amount of people that have diabetes. And it's believed that this increase will significantly occur among people in Latin America and the Caribbean. So this region is projected to be disproportionately affected by diabetes. Next slide. And more disturbingly is that a lot of people who are affected by diabetes are not older people, but a lot of younger people are now emerging with diabetes. As you can see here, where most of the bars are clustering, that people between 40 and 64 are developing diabetes at an alarming rate. And because it has such a damaging effect on the body, it could cause a lot of sickness and premature death. It really has a significant impact on the productivity and significantly impacts the workforce in these regions that are disproportionately affected by diabetes in the younger population. And this is worldwide data. And the next slide actually shows, specifically in Jamaica, Barbados, Trinidad, and Tobago, places where there's a lot of the data where people are looking about diabetes in the Caribbean. It's documented that also, not just worldwide, specifically in the Caribbean, really affecting the younger groups between 40 and 64, as you can see here in the maroon. Next slide. So, in terms of the leading causes of death in the Caribbean, like I said, the transition now is no longer infection, like many people outside of the Caribbean believe. It's now diabetes, and with that, heart disease as well. So really a significant public health effort needs to be dedicated towards this. In terms of the complications of diabetes, it can affect so many things. Blindness, ulcers, you can lose your legs, you can lose your toes, it can affect the nerves, circulation, it can cause kidney failure, and specifically it has a significant impact on having heart disease. And people with diabetes tend to have higher rates of heart disease, they have higher blood pressure, and that's the most common symptoms in patients with diabetes. So many of the patients that Dr. Fergus has seen this week have diabetes, often have high blood pressure associated with it as well. It's one of the most common presenting diseases that's associated with diabetes. Often people who present to hospitals with chest pain frequently also have associated diabetes, heart attacks, strokes, heart failure are disproportionately seen in people that have diabetes. In some of the data that I managed to come upon, this is an early study that was done just looking at the quality of care in different places in the Caribbean, and looking at, recording of blood sugar and the notes in public clinics. And of those that had, as you can see, and these are percentages, of those that had blood sugar recorded, 67% of those were poor blood sugar, so increased blood sugar. So every document that had blood sugars that were recorded, 67% of those recorded blood sugars were high. And in terms of blood pressure being recorded, 61% were high blood pressures of all the blood pressures that were recorded. This was presented in 2003 in the quality of diabetes care in the Caribbean. So clearly a very significant public health problem that's occurring and that needs our attention. Next slide. And this is just to present a little bit of what Dr. Fergus and Gilda did last summer, just to show that it is a serious problem everywhere, but the numbers are, what Dr. Fergus has seen, that the numbers are disproportionately higher here. In terms of people who were screened last summer, 200, 46% of those had high blood pressure and 28% of them had diabetes. Once again, a significant proportion, almost half, and once again, high blood pressure and diabetes tend to go together. And I'll end by just saying that, I very briefly said, told you, and you're very well aware of this, that it's a problem, not only here, we see this in New York, in the communities that we live in and the patients that we take care of, but not only, next slide, is it a problem, more of our young people are being affected by it, we're having a lot of significant illness and premature death by this. But some of the things that really lead to having problems with diabetes and being affected by it is, being overweight, not exercising, having it run in your family, having it while you were pregnant, high cholesterol and heart disease. So many, many things that we may not be aware of really help significantly increase our chances of having it. So once again, I'm going to stop here. This was just a brief refresher. It's been a pleasure being here. The week is going way too fast. I can't believe it's Wednesday already. Anyway, I'll turn it over to Dr. Fergus, who will give you a little bit more information on some of these things, and thank you.